Papworth Hospital in Cambridgeshire is hosting a global conference on a pioneering form of lung surgery which its doctors developed and allows patients to return home in as little as 24 hours. The procedure, which only takes 20 minutes, allows doctors to see and operate inside the body using a camera which leaves only minimal scarring. It allows patients who would have been too sick to withstand open heart surgery to undergo crucial operations.
Certainly when people are coming to visit you and they see how well you've recovered and they see you sort of sitting up and talking and chatting and having a normal conversation and normal eating and drinking, then you realise that it could have been quite different and much more complicated.
Yeah, we'll have more on the pioneering surgery on ITV News Anglia tonight at 6.
And about the latest pioneering work being done at Papworth Hospital.
Well, minimally invasive operations use cameras so patients can have life-saving procedures without the need for open chest surgery. Claire McGlasson's report does contain images of this surgery.
20 minutes is all it takes, an operation completed in half the time. The surgeon at Papworth Hospital takes a biopsy from this patient's lungs using a camera that's literally at the cutting edge. With just a small incision, he can see and operate inside the body.
Once you get used to the technique, from the surgical point of view, you can see a lot better because, things are brighter, are bigger. The incision is much smaller, and therefore we're not going to disrupt any of the tissues around.
In the past, some patients were simply too sick or too frail. They would not have survived open chest surgery. But now, thanks to this procedure, they're able to have life-saving operations. Papworth is now performing twice as many lung cancer operations as it was 4 years ago. Surgeons here removed an entire lung using the technique. The patient left with a scar no bigger than if he'd had his appendix removed. It means patients develop fewer complications and recover much more quickly, some returning home within 24 hours. Joanna Richards had surgery to remove damaged tissue in her lung 3 months ago.
And I just felt that I had been let off very lightly. And certainly when people are coming to visit you and they see how well you've recovered and they see you sort of sitting up and talking and chatting and having a normal conversation and normal eating and drinking, then you realise that it could have been quite different and much more complicated.
Papworth is hosting a global conference about minimally invasive surgery. 80% of Mr. Scarci's cases now use this technique, and he hopes it will become standard practice all over the world, saving more lives and making recovery as quick and as painless as possible. Claire McGlasson, ITV News, Papworth in Cambridgeshire.